Hi, everyone. I'm Beth Resnik, Assistant Dean for Public Health Practice and Training at the Johns Hopkins Bloomberg School of Public Health. So I'm here today to talk to you about actually a very unfortunate topic about a lot of the harassment, threats, and violence that our public health officials are facing across the country. And as we know, the pandemic has brought greater appreciation by many to the importance of public health and the people who work in the field. However, many health department leaders and their staffs have experienced threats to their jobs, their safety, their family members. These threats have come from their own community members, from organized anti-government militias, and even their politicians who are supposed to be leading. So today I have the pleasure of being here with Doctors Khaldun and McKenney to share a little bit about their own experiences in working in public health. So let me turn to you, Dr. McKenney, and can you share a little bit about a day in the life of a health officer? And thank you for all of your hard work throughout this pandemic.
Absolutely, Beth. Thank you so much for having me. Pretty much these days, it is still exhausting. It's a different kind of exhausting because last year we didn't know what we were doing. We were trying our best and we worked with the information we had. Now we're really focusing on vaccines and testing and educating and combating the misinformation out there. And so it's a different type of exhausting. That along with being a family physician, a frontline worker, doing the actual swabs, taking care of people in the hospitals. It is a lot of work, but it is meaningful work.
Well, again, thank you for your service. And how about you, Dr. Khaldun? Can you tell us a little bit about your experiences?
Absolutely. I mean, I can say for myself, as well as the many public health staff people and leaders who have been working on this really since I'd say at least January of 2020, well before anyone heard about some of the first cases in most parts of the country. Public health teams have been working on this since then. And it has been, as Jen said, exhausting. I more recently, in recent weeks, left my position there for a new opportunity, but I can say that it's been exhausting. And our teams have been responding not only to COVID-19, but all the other crises and public health needs in our communities, whether it's lead, Legionella, the opioids crisis. All of our public health teams are still working on that in addition to COVID-19. So it certainly has been exhausting.
Well, that's a great point about all the other things that you have to do on top of COVID. It's not like we can forget all of those. So let's turn a little bit more. I wanted to ask you a little bit more about your workforce and how they're holding up. So we've heard the bigger numbers are always about the health officials who've left their jobs. The statistics show over 300 have left their posts, and 1 out of 5 Americans have lost their public health leader. But the ones to the lower, not the leadership, the next level down, it's a little bit harder to track. We found in some of our research that over half of the health departments that had responded to our survey said they were experiencing some sort of threats or harassment. People were feeling disillusioned and morale. The CDC found last spring, 26% of public health worker respondents experienced stigma or discrimination because of their work. They felt bullied, threatened, and 12% had received job-related threats. So please tell us about your staff. And again, thank them for all of their great work. Jen, do you want to share a little bit about how your staff is holding up?
Sure. I'm a health officer in a county of about 9,000 people. And so our health department has 4 full-time employees. So it's a small one, but really with the 4 employees, they've been doing all the work, all the contact tracing, all the vaccinating, everything, and in addition to all the usual, vaccines and WIC and everything else that we expect our health departments to do. So unfortunately, from the time the pandemic started, we have had turnover of 3 of those 4 employees, and we are working on finding our 3rd health department administrator in the last 6 months. So we're still without an administrator at this time. I can tell you our staff has been some of the hardest working people that I've ever met, I guess. They're working evenings, weekends, and it's just been unbelievable under these circumstances. So it really is amazing to watch, but they are strained right now.
Yeah. So Joneigh, how about for your staff?
Similarly, in the state of Michigan, we actually have 45 kind of local or county health departments. And since the pandemic started, 8 health officers and 9 medical directors, that senior leadership, have left, resigned, or retired, which is significant. And I'll tell you what's been most concerning over the past several months in Michigan is that they've had their lives threatened. They've had people come to public meetings and verbally abuse them, physically threaten them, put their addresses out in social media and encourage others to physically or verbally assault them. It's quite concerning. We've had some of our local elected officials actually remove money and funding from local health departments if they do anything when it comes to COVID-19 recommendations or requirements for simple things like masking in schools. So it certainly is concerning, and we're concerned about the staffing situation across the entire state.
Sounds pretty brutal out there. We are forming a coalition here at Johns Hopkins called the Stop Coalition to stop threats and harassment against public health workforce. There's definitely a huge interest to support the workforce, and we all need to think about how we can address that. We will put up a link to our site, We Stand with Public Health, that talks about advocating for better protections, legal and law enforcement connections, and building a better public health infrastructure, giving our workforce better equipment and supports to be able to do their jobs. Another interesting fact that I want to close on actually is that, interestingly, we've also seen an inspiring uptake in interest in public health. Again, people know about public health, understand the importance in a way that they have never had before. We've had over 20 to 30% increase in applications to schools of public health across the country. I know here at Hopkins and at other schools of public health we're bursting at the seams with students. So I guess I'm thinking about looking towards the future. What do you see? How do we get out of this? How are we going to be better prepared for the next pandemic? Joneigh, do you want to share your thoughts?
Sure, those are certainly encouraging stats that you read off. I'd say one of the silver linings of the pandemic is public-private partnerships, and how we know that so many private entities have played such an important role in fighting the pandemic. So I think that's really, really important. And also making sure we fund long-term public health and public health departments. We have some federal dollars coming in across the country to states and municipalities, but we hope that lasts beyond just the next couple of years. We really need sustainable funding for our public health departments.
Great points. Jen, what are your thoughts?
Absolutely agree that we need more funding and more support, not just financially, but really support through the legislature and everything for public health, because that's really where we're hurting right now. I'm so excited to hear that students are seeing the work that we're doing and wanting to take up that challenge to work in public health in the future. And for them, I want to say that it's worth it. It really is. Public health, even though it's called public health, is very personal, and it really makes a difference with every single person's lives that you touch. And so the science, the data is important, but never forget that the public health that we're doing is truly about the people that we serve.
Thank you both. What an inspiration. And again, thank you to all your staff. And for the rest of us out here, please go to the We Stand with Public Health. We've got to work together to make this better and do better, be better prepared for our next pandemic. So thank you both. And it's been a pleasure talking with you.
Thank you.
Thank you.